how do I know if my husband is using therapy language to win an argument and shut me down? Or is he trying to use what he's learning and it's just a little clunky at first? So this is part 2. We're answering Tina's question. She left us a voicemail. If you missed that, go back to part 1, where her and her husband, they're in couples therapy and they're in individual therapy. But over the past few months, she's noticed that when she brings something up to him, he's using therapy phrases to kind of shut her down and not take any ownership. So that's your projection. That's just your perspective. I'm not responsible for your feelings. And then he's also using tools from like the Gottman School of Therapy in a wrong way, which I'll get to in just a second. But there's 3 concrete tells that I use to distinguish what is this. Like, are they just trying to use it and it's a little bit clunky because change is messy? Or is this a defense tactic? So number 1 is timing. Is my husband only using these therapy phrases when I get escalated and he starts to get uncomfortable or maybe being called out? So he's using it as a way to just diffuse it, get me to be quiet or shut down everything. So timing of when he uses a phrase. Number 2, direction. Like, does it only flow one way? Are these concepts only applied to me? Or does he also say, or maybe I'm projecting? So direction. And number 3, the outcome. Does the use of the phrase or concept improve the outcome of the conversation? Are we feeling more connected at the end of our conversation? Does it improve our connection? For me, I see the language being used as a defense mechanism, not out of malice. Some of us are not good when emotions rise, and rather than being more curious and asking questions like Tina's asking, some of us reach for control because we feel threatened. And part of control, we use any tool we have. And in therapy, we're learning a lot more tools. And sometimes phrases or concepts can be used as a shield. So it's almost like a shield just to deflect, just to kind of get the heat back away, using things that we learned in our childhood, like escape or deflection. But therapy is used to bring people together, improve intimacy, not build up defense mechanisms. So in part 3, I'm going to walk you through what I see through the family systems lens. I'm also going to give Tina a script that she can talk to her husband in the moment without shaming him. Also, redefining what a 20-minute break looks like and how it's intended to be used by John and Julie Gottman.